Hey guys, Dr. Klosterman, Shannon from Rise Chiropractic and Acupuncture. Hey, we want to take a second during our day and share in social media land something that over 20 years of experience, I've felt that has helped more patients and myself personally more than any other exercise I've ever demonstrated or given. It's fantastic for just overall spinal hygiene. In this section, we're going to talk specifically about lower back and a little sciatica that you can do it for too. So all credit goes to Dr. Goodman, Eric Goodman with the foundation trainings, fantastic information. So it's all based on one foundation to the entire training, which is called the founder pose. So we're going to go through with the help of our lovely assistant, Shannon, and I'm going to try to demonstrate how to do the foundation pose. If you do it correctly every day, so this is something you can do every day, you're going to improve your posture and really overall improve your core strength, which we'll talk about. So we're going to start with her feet shoulder width apart, about 2 feet, okay? We're going to start off by standing chest up tall, meaning we're going to decompress our spine by lifting our chest up off our bodies, okay? And so we're going to hold that there for 1 second, and I want you to basically press your heels to the ground. And so we're going to press our heels to the ground, and our knees should be centered over our heels. So our knees shouldn't be too far forward. Go ahead, too far forward. That's not what we want, okay? Now we're collapsing the arch. We're collapsing the spine. So we want our knees right over our heels, pressing our heels into the ground. And what we're going to do is we're going to unhinge our pelvis, and we're going to bend from the pelvis. Okay, it's showing what not to do. You don't want to bend forward. We don't want that. That's collapsing the spine. We don't want that. We want to unhinge your pelvis. Come forward just to where you start to feel the tension, usually right about there. And what I'm going to have you do is unscrew your shoulders, locking those shoulders into place, not letting them collapse, but locking them into place. Unscrew the shoulders, coming back, and really, really reaching back with intention. Really getting back there. And it's really nice if you spread those fingers, reach back. That sometimes can help. That's perfect. And so once we get in this pose, I want you to hold it for about 1 good full breath, okay? So take a deep breath in while decompressing your spine, keeping your chest up off which is difficult, up off your body and off your spine. And so once we get in this position, you had a nice, good deep breath, you're pressing the heels into the ground, keeping your hip and pelvis and your butt all over your heels. What you're going to slowly raise your hands, keeping everything the same, raise your hands straight up, locking, making sure we got the shoulders locked into place here, not letting your shoulders collapse, okay? Raising up, you can come forward just a little bit, and I don't want you looking, go ahead and look up. That's not it, okay? You gotta look forward, straight, a little bit up higher right there, almost like you're holding a ball and you're reaching out and getting that ball. You're reaching out, so you're stretching the spine, we're forcing gravity through your hip and pelvis and through your heels. You hold that there for about 10 to 15 seconds. This can get a little shaky for some people, but it's something you can do every single day. And what we're doing, we're just lighting up the posterior chain extension muscles. This is your core. This is not your core. This is your core. You're doing abs all day, will not help your lower back. This will help your lower back. It'll help reduce that adaptability that we've done, and we're sitting all day in that really sitting pose. Okay, so you keep that up. She's getting tired. Okay, so what we're going to have her do is come on down, slowly come down, and then you can uncork the shoulders and just relax. Okay, so that's number one. That's a fantastic founder pose. That's the basic founder pose. We're going to show you two other ones. One is going to be a wide foundation, and so you're going to just really wide. And this is going to give you, sometimes it can be a little bit more tension on the lower back, so we can just kind of elevate the tension a bit. Everything goes the same. So nice and wide, making sure not to bend those knees, because we don't want to bend the knees, right? And we want to keep a slight bend, if anything, but we want the knees behind or level with the heels. Okay, so first I'll start with decompress your spine by opening up your chest really high. Keep those heels planted, yes, because the tendency is they'll kind of come off, and that's what you want to fight. Yep, and that's not good. So we're going to keep that hinged right over your heels. And so, okay, once we got that deep breath in and we hold that chest there, we're decompressing the spine, we're elongating the abdomen. What we're going to do is we're going to unhinge the pelvis going forward. Excellent. Get those hands off your hands there. And now we're going to uncork your shoulders. We're going to really reach back, spreading your fingers open really wide. You're going to hold that for a nice, good breath. Very, very good. You should feel that right in there. If you feel in there, you know you're doing it right. Okay, keeping everything equal. We're going to raise the hands, keeping the shoulders locked in place because the tendency is to let them go forward like that. Okay, that's why I keep saying that. Keep those forward because what's the tendency is they just kind of go, what they'll do is they'll kind of let the shoulders go forward. So lock them back in place, keeping those chest up, right? Hold that for about 10, then you're going to hold that for another 10 to 15 seconds. Reaching out forward, straight through your heels, forcing the balance and everything to go through your butt, through your knees, and through your heels, okay? You should really start to feel that. 10 to 15 seconds is perfect. Now, come on out of the pose, bring your hands down first. And if you want to, you can put your hands right here on your legs and then come on up slowly, and you're out of the pose. So here's a really great trick if you have any sciatica. For 20 years of experience, we get a lot of patients in here with some sciatica or even IT band, a lot of athletes. And so the only difference in this pose is you're going to be pigeon-toed in the founder pose, okay? So what you're going to do, can you see that, is we're going to pigeon-toe our feet. Perfect. And what we're going to do, same principles, okay? Really hard. You're going to be forcing, it's going to kind of want to force your feet up and out, but you're going to fight that pushing down into the middle part of your arch. Okay, that's perfect. And so what we're going to do is, again, push pressure right through the heels, keeping those knees above your heels, butt through the heels, unhinge. So you're going to decompress your spine. Did you decompress your spine? I think she forgot to decompress your spine. Did you do that? Oh, sorry, you did it?
So we're just breathing?
Yep, in, and now go forward and unhinge your pelvis. There you go. Get that, there you go. Good, good, good. Now, we're going to unhinge your shoulders. Excellent, keeping the pressure off your chest, like lifting. Now we're going to lift straight up. There you go. Got tight scrubs. Wear loose clothing. Okay, you're going to hold that for about 10 to 15 seconds. That's perfect. That is perfect right there. And because what's happening is she's balanced. Now, some of you won't be able to go this far. That's okay. Some maybe just go like this. She's very flexible, so keep that in mind. So she has to unhinge that pelvis a little bit more to get tension on that lower back. Okay? Perfect, perfect, perfect. So reach up high really intensely. You're going to feel that iliotibial band, a little bit of stretch, and you'll get pressure off the muscles that are contracting sometimes with the sciatic nerve pain. So go ahead and bring your hands down. Awesome, come on right out of pose, and you did it. You cannot do this pose enough. I have a challenge. I like to challenge my patients. Do it for 30 days, every single day for 30 days. And I will promise you, you'll feel better, you'll feel stronger, and actually you'll have less back pain at the end of that. One of the best poses I know how to do, so let's get at it, let's get doing it. There is a link if you're interested in learning more about what we do here in Jacksonville and Mandarin specifically. Come and check us out. I got a get acquainted offer. If you click the link, come and check us out. You can learn more about it. So thank you and hope to see you soon in our office.